Hey guys, how are you doing and how is your day going? So, there's something that has been on my mind lately, and I feel I should talk about it. And this message is precisely to health workers out there. So, if you're a nurse, you're a doctor, a community health worker, whatever profession it is that you've decided to do and who you want to be, please, I want you to remember that it's okay to ask for assistance. It is okay to say you're not familiar with this procedure and you need help. It's okay for somebody to put you through. There's nothing wrong with you learning. We learn every day and it's okay. If you're not really certain of certain tasks that you're being asked to do, you can actually ask for assistance instead of just being so negligent about a lot of things. A lot of people have lost their lives due to certain mistakes that health professionals made, which is very, very wrong. If you're not good with something, if you're not so perfect with something, you should ask for directive on how to do it and how to go about it. And then in some cases, if you've already made a mistake, you should call the attention of somebody above you or a colleague and explain that, okay, this is what I administered and I think is wrong. What do we do about it? How do we reverse the effects? How do we save this person's life? That is how it's supposed to be. You saying you need assistance does not mean that you're dumb or you don't know what you're doing. No, it shows that you are willing to learn. And at some point in our life, we make mistakes, yes. But how do you go about correcting your mistakes? That's something that should count. Do not make somebody lose a mom or a dad due to your lack of, you're just irresponsible about very little things. When it comes to health, you should know you should prioritize that person. We're talking of life and death here. And if at some point you are actually perfect, you know what you're doing with certain procedures or certain tasks, please pay attention to whatsoever it is that you are doing. Even if you're good at it, pay attention to it. There are times you get carried away, there are times you forget certain things, there are times, I don't know how to explain it, but you see this guilt that comes with certain mistakes you've made, costing somebody their life or their health. It's something that you should not even pray to find yourself in. That guilt will forever haunt you down. If you're a nurse, if you're a doctor, whoever you are, and you feel like, okay, yes, I'm a health personnel, but I don't want to practice, it's okay. Probably you feel it's too hectic or you're too busy or that's not what you want to do. It's okay for you not to practice. But as long as you've decided to practice this, please prioritize people's lives. They have family out there. They have family, friends, people who care about them. They have a life to live. There are a lot of destinies attached to theirs. Please pay attention to whatsoever it is you are doing. If you're not good at something, please ask for assistance. I am not ashamed to say I need help. Ma, can you put me through? I need assistance on how to go about this and how to do it. It's totally fine. You don't have to prove that you know it when you don't know it and then you go about making mistakes. This is you putting somebody's life in danger. This is you making people lose a lot of things because you made a mistake and you're not even ready to accept the fact that, okay, you made a mistake. Sometimes you make mistakes and then you just go quiet about the whole thing because that person or the patient or client will not even know. So I hope the message was well passed. I hope you know that asking for assistance is totally fine. You saying you don't know how to do something and you're willing to learn is totally fine. And if at all you know how to do certain things, please pay attention while doing it. Make sure that nothing takes your mind off whatsoever you are doing. Stay focused. Learn to prioritize your patient or your client's health because that is what you've signed up for. Please pay attention to whatever you're doing when it comes to somebody's health. Thank you. Bye.